This poster presents the case of a 50-year-old female with severe bilateral acrocyanosis who underwent a recently FDA procedure called osseointegration. Initially, the patient presented to our clinic back in 2018 with a predating left transtibular amputation due to her severe acrocyanosis. Despite multiple failed revision surgeries and neuroma excisions, the patient could not tolerate a standard socket prosthesis. Eventually, she opted for OI, osseointegration, a procedure where a metal implant is inserted into the bone, allowing direct attachment of a prosthesis, thus eliminating any socket-related issues. After her OI procedure, outpatient physical therapy focused on implementing a weight-bearing protocol. The standard protocol for OI patients typically includes 6 phases, beginning no earlier than 4 weeks post-operatively. Phase 1 involves progressive axial weight bearing, starting at 40 pounds for 30 minutes twice a day, with a goal to increase the load by 20 pounds weekly as tolerated. However, due to this patient's low body weight, her rehabilitation process was adapted to a half-speed weight-bearing protocol. For this patient, phase 1 was modified to begin with 20 pounds instead of 40, increasing by 10-pound increments every 2 weeks as tolerated. She successfully completed phase 1 and progressed through the remaining phases with no significant issues. This case highlights the need for individualized rehabilitation protocols in OI patients, ensuring successful outcomes through careful adjustments to the weight-bearing process. It also underscores the transformative impact of OI in improving quality of life for patients by eliminating socket-related complications and improving prosthetic daily wear hours, proximal joint range of motion, K levels, and overall energy conservation.